Of all the jobs a caregiver has to do, one of the most challenging is transferring residents from one surface to another. For one thing, manually lifting a resident poses a real physical threat to both the caregiver and the resident. If you try to do the transfer manually, then you have to rely on your own strength and physical capabilities to perform the task. You run the real risk of not only mishandling, dropping, and injuring the resident, but also injuring your own back and shoulders in the process. On top of that, there's another risk, and that's the risk of injuring the resident's dignity. And preserving human dignity is an essential part of good health care. Mechanical lifts eliminate these risks because they're designed to safely transfer a resident with dignity from one surface to another. And because they're designed to handle the weight of the resident, they minimize the burden for the caregiver. Invacare lifts and slings are made of top-quality materials to ensure that residents feel comfortable and secure at all times. Invacare lifts are designed to make the caregiver's job safer and easier. They feature ergonomic push handles, low-friction, smooth-rolling casters, widening bases to accommodate wheelchairs, padded hanger bars, and more. These high-quality lifts are important and reliable tools for both residents and caregivers. There are two basic types of lifts: full-body lifts and stand-assist lifts. Full-body lifts are typically used with residents who are totally dependent. It's normally used for everyday transfers like moving the resident from bed to a chair. But it can also come in handy in situations like lifting a resident who has fallen to the floor. Stand-assist lifts are used for residents who are partially dependent, can sit with assistance or without assistance on the edge of the bed. They have some ability to bear their own weight, have head and neck control, are able to bend at the hip, knees, and ankles, and are coherent and cooperative. Stand-assist lifts are designed to quickly transfer a resident between two seated surfaces. They can be used to move the resident from the bed directly to the commode, eliminating the intermediary steps of manually transferring to a wheelchair and then from wheelchair to commode. The resident also gets to participate in the transfer process when you use a stand-assist lift. This gives them a greater sense of independence and provides the physical benefits of standing. The resident's profile will help determine what type of lift is needed. When selecting a lift, factor in the resident's weight, their ability to bear their own weight, and other criteria such as their strength, balance, spasticity, amputated limbs, pain, cognitive ability, and ability to communicate. The sling you choose will be determined first by what type of lift you have or are purchasing. Only Invacare slings and accessories should be used on Invacare lifts. Read and understand the owner's manual before attempting to use this type of equipment. Please consult the Invacare sling chart or owner's manual to be sure you're purchasing the appropriate sling for your lift. Our slings are lightweight, durable, and easy to use. Full body or comfort style slings which accommodate the greatest range of residents and are left under the patient while seated. Divided leg or universal style slings which can be easily removed while the resident is seated. Choose the style that's most appropriate for the resident and the intended transfer. Consider the reason for the transfer. If the lift and sling will be used for toileting, then a toileting sling or sling with a commode opening may be the best choice. Invacare offers a full range of slings that best suit your needs. At Invacare, our goal is to help you provide safe and effective health care with top quality, reliable products. When you partner with Invacare, you partner with the best in the industry.